Eye on Health on WSBT 22 is sponsored by Beacon Health System. You're watching WSBT 22 News at 5.
The area's largest health system is working through this latest surge of COVID patients with a program that focuses on the caregiver.
The rollout was just before the pandemic started and originally designed to address only the most traumatic events. In this month's Eye on Health, WSBT 22's Bob Montgomery looks at this Beacon Health System program that's been put into use far beyond what was anticipated.
It's called SHINE, Supporting Health in Negative Events.
A shine is prompted by anything that is beyond staff's ability to cope. So staff is having a normal reaction to an abnormal situation.
Sarah Sampson is Beacon's Manager of Supportive Services. She was part of the team who developed this program in 2019 to either call on group or one-on-one talking sessions. The goal is to help the staff handle the mental and emotional strain of incidents like bad car crashes or shootings involving children, anything out of the ordinary. Then COVID hit. What was designed as a targeted, isolated response to traumatic events turned into regular all-hands-on-deck sessions.
We started doing a rolling shine calendar, so we would have them open to all associates, and then we did them open to specific areas that were hardest hit by COVID. So affects people personally in so many ways. Their family members are getting sick, or they're scared that they might bring it home to them, or they have childcare issues. It's all of that stress.
Who's coming to talk to you?
Everyone. Everyone who touches a care team member that's part of our system. And
Rachel Savoie says the idea behind Beacon's development of this program is simple. Caring for the staff first allows the best, most qualified staff to stay healthy themselves and focus on caring for the patients.
you can see the strain. You can see how tired people are, and it feels somewhat unrelenting, but we also have a duty to serve our community, and I think most of the time that outweighs so much of the feelings that we have, so we compensate.
Some of these doctors and nurses tell the team they now have anxieties they never realized they had before. These SHINE sessions help the ones who are at the end of their limits have a release and stay where they're needed most.
They have to be out there and get air and light of the rest of your team that says, I get that, and I feel that way too, and we're in this together, and you're not the only person who's experiencing that stress.
You see a light at the end of the tunnel?
Well, I'm a chaplain, so I always see a light at the end of the tunnel. The light is that we're realizing as people that we have to do a whole lot better job taking care of ourselves, or we're not going to be able to do any kind of caring profession.
Beacon Health developed this system based on an international program to help first responders and military members ward off post-traumatic stress disorder. For Eye on Health, Bob Montgomery, WSBT 22 News.